Can child food intolerance symptoms be mistaken for allergies? Have you ever wondered if the symptoms your child experiences after eating certain foods could be mistaken for something more serious? It is a common concern among parents. Understanding the difference between food intolerance and food allergies is essential for your child's health. Yes, symptoms of food intolerance in children can often be confused with food allergies. Both conditions can present similar signs like stomach pain, diarrhea, nausea, and skin reactions such as mild rashes or itching. However, the root causes and severity of these issues are quite different. Food allergies involve the immune system reacting to a specific food as if it were harmful. This reaction typically happens quickly, within minutes to a few hours after eating the allergen. Symptoms can range from hives, swelling, and vomiting to more serious issues like difficulty breathing or even anaphylaxis, which can be life-threatening. Children with food allergies usually react every time they consume the allergen, even in tiny amounts. On the other hand, food intolerance is related to the digestive system. It occurs when a child's body struggles to break down certain foods, often due to a lack of specific enzymes, like lactase and lactose intolerance. Symptoms of intolerance usually develop more slowly, sometimes taking hours to appear after eating. Common signs include gas, bloating, cramps, diarrhea, and mild skin irritation. Unlike allergies, food intolerances are generally not life-threatening, and children may tolerate small amounts of the offending food without experiencing symptoms. Because some symptoms overlap, parents might confuse food intolerance with food allergies. However, allergic reactions often involve immediate and severe responses, such as hives, swelling, or breathing difficulties, which are not typical of food intolerances. Understanding this distinction is important for creating healthy eating habits for your child. Misidentifying food intolerance as an allergy can lead to unnecessary food restrictions, which might limit essential nutrients needed for growth and development. Conversely, missing a true allergy diagnosis can pose serious risks. To accurately identify whether your child has a food intolerance or an allergy, consulting healthcare professionals is vital. Allergy specialists or gastroenterology experts can provide the right evaluations. When managing picky eaters, knowing if a child has an intolerance or allergy helps tailor dietary choices safely. For intolerances, gradual introduction of small amounts or enzyme supplements might be possible, allowing for nutrient intake without discomfort. For allergies, strict avoidance of the allergen is necessary, and alternative nutrient sources should be provided to maintain a balanced diet. While child food intolerance symptoms can resemble allergies, they differ in cause, timing, severity, and management. Accurate diagnosis supports healthy eating habits, ensuring children receive necessary nutrients without unnecessary food avoidance or risk.